Hi there, welcome to Scratching the Surface. My name's Kamron, I'm a social work student at the University of Toronto, and I'm doing my practicum placement this summer at Recalibrate Therapeutic Services. In this video, I'll be covering eating disorders, what they are, what causes eating disorders, I'll address some myths about eating disorders, and then I'll jump into the research literature about risk factors and treatment approaches, established and emerging ones. So without further ado, let's get into it. Here's my presentation on eating disorders, and we can begin with a definition. So eating disorders are serious medical conditions involving severe and often persistent disturbances in eating behaviors and associated distressing thoughts and emotions that impair psychosocial functioning. And I've included a list here of examples of eating disorders. First on the list here is anorexia, where a person may restrict themselves from eating or eat very little for fear of weight gain or for concerns of body shape. A person with anorexia often presents as skinny in appearance, but they may not see that themselves. They may perceive themselves to be overweight when they look in the mirror, when they are actually underweight for their age and height. Second on the list here is bulimia, and some of the symptoms of bulimia overlap with those of anorexia. So some of these eating disorders may present simultaneously for an individual. A person who has bulimia may have recurrent episodes of binge eating, followed up by what's called compensatory behavior, such as fasting, self-induced vomiting, laxative misuse, or excessive exercise to prevent themselves from gaining weight. So you could imagine that someone may have an average body mass index but may still be suffering from bulimia and possibly co-occurring anorexia. Next on the list here is binge eating disorder, and this is characterized by recurrent episodes of binge eating, except they're not followed up with compensatory behaviors as is the case with bulimia. People with binge eating disorder mostly present as overweight or obese in appearance. Another example is avoidant restrictive food intake disorder, which is a pattern of avoiding food or selective eating that results in nutritional needs not being met. These patterns often fall into three categories. One is a lack of interest in eating. Second is sensory-based avoidance, so a person may not like the texture or color or smell of a certain food. And third is a fear of consequences, like choking, vomiting, or having an allergic reaction to a certain food. Pica is an eating disorder in which a person eats non-food items with no nutritional value, such as paper, tissues, paint chips, hair, and things like that. There's a variety of reasons why someone may engage in that behavior. They may have learned it, they may have anxiety or other mental health conditions. Last on the list here is rumination syndrome, and this is when a person may regurgitate swallowed food to chew it again or to spit it out, and this may happen intentionally or unintentionally. Now, these are just some examples of eating disorders. There are plenty more that exist, but for the purpose of this video, I'm going to focus mainly on the first three on this list. So now that we have a decent understanding of what eating disorders are, we may be wondering what causes eating disorders and who does it impact? Well, eating disorders can affect people of all ages, racial and ethnic backgrounds, body weights, and sexes. Even people who appear healthy can have eating disorders and be extremely ill. People with eating disorders can be underweight, average weight, or overweight. So that dispels the myth that only people who are underweight or overweight have eating disorders. Even people who are average weight and who otherwise look healthy may have an eating disorder. There's no single cause of an eating disorder, and it's often the combination of factors, including biological factors, which may involve having a close relative with an eating disorder or mental health condition, or having a personal history of dieting, or personally having a lower energy capacity, or personally being diagnosed with type 1 diabetes. Psychological factors may include perfectionist tendencies, cognitive inflexibility, emotional dysregulation, impulsivity, a tendency to want to distract oneself, personal body image dissatisfaction, and a personal history of mental health conditions or substance misuse. As well, some of the social factors include weight stigma, teasing and bullying, appearance idealism, acculturation, isolation and loneliness, and a personal history of trauma. And social media certainly plays a role in making people more insecure about their body shape and weight, and making them potentially develop an eating disorder as a result. Now, it's important to consider that people with eating disorders may have serious health complications if their eating disorder goes untreated. For people with anorexia, they may develop osteopenia or osteoporosis, which is a dangerously low bone density. They may develop anemia, severe constipation, slowed breathing or pulse, infertility, brain and heart damage, or multiple organ failure, among other things. For people with binge eating disorder, they may develop obesity, type 2 diabetes, cardiovascular problems, sleep problems, and gastrointestinal symptoms. For people with bulimia, they may have a chronically inflamed and sore throat, worn tooth enamel, and increasingly sensitive decaying teeth, acid reflux disorder, intestinal distress and irritation, severe dehydration, and electrolyte imbalance. And that's just a result of possible laxative misuse or other compensatory behaviors such as vomiting or fasting. On this slide, I've listed some of the mental and physical health conditions that may co-occur with eating disorders. For mental health conditions, there is depression, generalized anxiety disorder, obsessive compulsive disorder, ADHD, bipolar disorder, post-traumatic stress disorder, and gender dysphoria. And for physical health conditions, we can see diabulimia, which is when a person with type 1 diabetes withholds insulin to lose weight, which could be life-threatening. There's also gastroesophageal reflux disease, irritable bowel syndrome, gastroparesis, which is when the stomach takes too long to empty its contents into the small intestine, which may lead to vomiting or internal blockages, and celiac disease, which is an autoimmune disorder where eating gluten triggers an immune response that attacks the small intestine. So by understanding these co-occurring mental health and physical health conditions, it becomes more understandable why someone with IBS or gastroparesis or celiac disease may also have avoidant restrictive food intake disorder, because they may fear the consequences of eating something that their body cannot process properly, and so they avoid eating altogether or they skip meals regularly. So thus far in the video, we've already debunked a number of myths about eating disorders, but I've pulled 4 more from the website for Johns Hopkins Medicine, and the first one here says that a person only affects their muscles and body fat by not eating, but the fact is that eating disorders lead to severe malnutrition that affects nearly every organ in the body. The second myth here says that eating disorders are a choice, but the fact is that eating disorders are complex medical and mental illnesses that individuals do not choose, and that's proven by the co-occurring mental and physical health conditions that I went over in the last slide. The next myth here says that you can't die from an eating disorder, and the fact is that eating disorders have the highest rate of death of any psychiatric illness. Up to 20% of people with chronic anorexia will die due to their illness if it is not treated. And the last myth here says that eating disorders are rare, but the fact is that eating disorders are the 3rd most common chronic illness among adolescents after obesity and asthma. And again, it's easy for eating disorders to fly under the radar, especially if a person is of average weight and otherwise looks healthy. Of course, there's also people who don't have the time or money to get the help they need to address their eating disorder. Now, getting into the research, in a study that gained insight on the mental health aspects of binge eating disorder, the researchers recruited 14 experts on eating disorders who were recruited on the basis of having published a journal article on eating disorders or having credibly won awards relating to eating disorders. The researchers found that all 14 experts agreed on the relevance of anxiety and depression to binge eating disorder. 13 out of 14 believed that ADD or ADHD was relevant, 11 out of 14 believed that substance-related and addictive disorders played a role, 10 out of 14 believe that OCD has a role, and 9 out of 14 believe that PTSD also has an association with binge eating disorder. The study went into great detail on how these experts believe these mental health conditions have an association with binge eating disorder, by explaining the nature of the relationships, the possible mechanisms linking these conditions to the eating disorder, and other factors that may alleviate or worsen symptoms relating to the co-occurring conditions. The next article I'd like to share involves a team of researchers who reviewed 284 high-level evidence studies to synthesize the information relating to risk factors associated with eating disorders. After collecting all this information, they created 9 main risk factor categories. Those are genetics, gastrointestinal microbiota and autoimmune reactions, childhood and early adolescent exposure, personality traits and mental health comorbidities, gender, socioeconomic status, ethnicity, body image and social influence, and elite sports. What I find interesting about this article is how the team of researchers went so in-depth with the biological, psychological, and social factors that contribute to an eating disorder. The details under each risk factor category really proves that it takes a combination of factors to trigger or activate an eating disorder in someone who already has a predisposition to it, and that some factors are stronger or have more influence on a person than other factors, but also that treatment options are available for those who wish to manage their eating disorders and improve their physical and mental health. Next, I'd like to present to you an article in the research literature called The Associations Between Gender Dysphoria, Eating Disorders, and Mental Health Diagnoses Among Adolescents. In this article, the researchers assessed the electronic health records of over 57,000 patients aged 9 to 18 between 2009 to 2022 to find associations between gender dysphoria, eating disorders, and mental health diagnoses. The researchers found that youth with gender dysphoria had greater odds of having an eating disorder compared to those without gender dysphoria, that they have greater odds of eating disorder diagnoses other than anorexia, and that youth with both gender dysphoria and an eating disorder had greater odds of co-occurring anxiety, depression, suicidality, and self-harm compared to those without gender dysphoria. For these reasons, the article really serves as a call to action for our healthcare systems to develop specific treatment responses for transgender, non-binary, and gender-expansive folks that collaborates with interdisciplinary teams, focuses on parsing gender dysphoria from other body image concerns, and is ultimately gender-affirming, weight-inclusive, trauma-informed, and anti-racist. So now turning to the research literature regarding the treatment approaches to eating disorders, we can see that family-based therapy is a first line of intervention for children, adolescents, and young adults still living with their families and who may have the support of their families to manage their eating disorders. As well, an enhanced version of cognitive behavioral therapy exists, which is a highly individualized approach which focuses on the maintaining factors of certain eating disorders. Multiple studies demonstrated significant improvement in weight and reduction in eating disorder psychopathology. As well, cognitive remediation therapy, exposure and response prevention, acceptance and commitment therapy, and DBT have all shown promising results in randomized controlled trials in addressing eating disorders and reducing the symptoms associated with them. An interesting article in the research literature on treatment approaches to eating disorders was this article on virtual reality therapy, which is an emerging treatment approach. An example of how VR therapy works is that a participant puts on a virtual reality headset, which puts them in a setting where they may have triggers related to their eating disorders, and at the same time they're receiving CBT from a therapist who monitors them during the process. The article explained that in clinical trials, VR therapy was more effective at reducing body dissatisfaction and fear of weight gain for participants with anorexia, that participants had a lower frequency of binge and purge episodes at 9-month follow-up for those with bulimia, and that participants with binge eating disorder reported improved body satisfaction, self-efficacy, and motivation for change. However, before VR therapies are implemented in clinical settings, replication studies are needed alongside a standardization and extension of their methods. And now, to close the video, I'd like to talk a little bit about the future of treatment, which would include apps and AI. Smartphone apps have already shown efficacy in helping to manage eating disorders by themselves and in conjunction with standard treatment. Nearly 2/3 of clinicians from one study endorsed using the apps with clients. And the only reason that the other clinicians in the study hadn't is because they either didn't know how to use the apps or didn't know which apps to use. But the clinicians who endorsed it reported positive outcomes for themselves and for their patients with eating disorders. As well, in certain articles discussing the use of AI in treating eating disorders, they reported that the benefits could include increased access to care through 24/7 chatbots that can help with engaging the patients more in their treatment plans and creating more personalized treatment plans for them, support for providers, and scalability because it doesn't cost much for AI to reach a large patient population. However, the article did report risks, and these are substantial risks, of incorrect or harmful information, dependence on data quality where the quality may be poor, the potential for patients to misinterpret the information from the AI chatbots, and of course ethical and privacy concerns. But overall, if AI developers and researchers are able to address these risks and mitigate these concerns, then artificial intelligence really stands to help clinicians and patients address eating disorders. But that's just scratching the surface. There are also pharmacological treatment approaches to eating disorders, but I only discuss the psychotherapeutic interventions because I'm a student social worker, not a student doctor or pharmacist. If you'd like to learn more about eating disorders, then I always leave the sources to my videos in the description below. And if you have an eating disorder or you know someone who does, then please reach out to a doctor or a dietitian who may be able to help you. Otherwise, if you're seeking mental health support, then don't hesitate to reach out to Recalibrate Therapeutic Services, where the experienced mental health practitioners can help you with non-judgmental and compassionate care. Thanks for watching, I hope you learned something, and I'll catch you in the next one. Take care.